Hey everyone, I'm Lauren Fleming, the founder of Hem Supportwear, and today I get to talk with Anna McMaster. She's a pelvic floor physical therapist with over 9 years of experience treating women across the lifespan, from pregnancy and postpartum recovery through menopause, chronic pelvic pain, and musculoskeletal conditions. She recognizes the significant barriers many people face in accessing specialized healthcare, so she founded Amie, which is an innovative company that delivers expert pelvic wellness care directly to women through their phones. Her mission centers on accessibility, working to ensure that quality pelvic health treatment reaches individuals regardless of their geographic location or other traditional healthcare obstacles. Through her clinical expertise and her entrepreneurial vision, she is helping to transform how pelvic wellness is delivered and experienced. And I am so excited to talk with her today. Okay, everybody, we're here today with Anna McMasters. We'll go ahead and jump right into the questions. Or first, I'll just let you say hello and just briefly say who you are, and then we'll jump right in.
Yeah, hi, I'm Anna McMaster. I'm a pelvic floor physical therapist and also the founder of Amie, which is I call it your pelvic floor PT in your pocket, an app. So I'm excited to chat with you today. Thanks for having me.
Yeah, thank you. I'm so excited. So yeah, we'll dive in and talk about all things public health, get to learn more about the app and learn more about what Anna's been working on. So starting here with our first one, I'd like to just kind of start with the spark and what inspired you to create this AI empowered app, or I'm sorry, AI powered pelvic floor app. And just like, was there a personal experience or a gap in care? Just walk us through that journey.
Yeah, I mean, it was kind of both. I experienced this issue kind of from both sides, both as a provider, pelvic floor PT, and as a new mom. And so, as a provider, I witnessed this over and over again with my patients, where I would see a pregnant patient all the way through her pregnancy. We'd get to the end, schedule that first postpartum appointment, just like a couple weeks postpartum, and inevitably that appointment would always get canceled. And, from when I was a new mom, I then kind of got it, right? There's
Right.
in those first few weeks postpartum, you're like, how am I supposed to, you know, leave my child for a couple hours, right? They're gonna need to eat. And so can someone take care of them? Or like, am I supposed to bring this baby with me? It's just kind of, a logistical nightmare.
Yes.
Um, and so it is just kind of a shame because then those patients either, never come back
Right.
or they come back several months later and they tell me like, oh, I've been dealing with, leaking and back pain and hip pain and prolapse and all of these things for several months and just suffering with that. And I just felt like there's got to be like a better way to get these patients the help that they need during this very kind of chaotic time in their lives.
Really, yeah, no, I can totally relate to that because for me, I was like a 40-minute drive from my PT, and then yeah, trying to juggle
Yeah.
that with a newborn and you're in the car, and yeah, even when you can take them with you, it's stressful because it can be hard for you to focus because you're constantly worried about this tiny newborn baby. It's like it's great when you can bring them along, and I love that option, but it's still you're just like and then yeah, I feel like baby ends up taking front seat and then your things kind of get put to the side and then time flies too. You'll turn around and it's been 2 months, 4 months, 6 months. And yeah, I can totally understand and relate to everything that you just said.
Yeah. I did a couple pelvic PT visits myself when I was postpartum because I was like, I need to prioritize this.
Right.
But I remember the first time I drove to my PT, and yes, it was very far, about like 40 minutes. Um, my baby, she like threw up all over herself
Oh,
in the car.
of
And I
course.
was like, oh, now I have to like
Yeah.
find parking, clean you up.
Yeah.
I think I luckily had brought like another change of clothes.
Okay.
It was just like a
Yep.
disaster.
Yep.
And
Well,
you're
yeah. And
just
then you're
like,
probably running late because you didn't budget time for the throw up and clean up and
yeah, yeah, yeah.
yeah,
So
crazy.
it was not the best PT visit. Let's just say that.
Understandable. I'm sure a lot of people can relate. Oh, so I've heard you said it just now when I was reading how you describe the app as pelvic floor PT in your pocket. Can you walk us through what that means in practice and what a typical user experience would look like?
Yeah, so I wanted to try to replicate as much as possible that experience of going in to see a pelvic floor PT in person, but just in app form. And so what that kind of looks like on the app currently is when you first log in, you are prompted to answer a few questions. I definitely ask way more questions in person, but I tried to keep it quick and snappy for my moms.
Sure.
About 5 to 7 questions talking about are you pregnant or postpartum? How many weeks? What are your goals? Stuff like that. And then they are prompted to take what I'm calling benchmark strength assessments, where we measure like what's your baseline core, hip, glute, pelvic floor strength. Um, Again, tried to tailor it to the pregnant and postpartum experience, tried to be like as focused as possible. And then after that, each day users are prompted to enter in the symptoms that they're feeling that day. So, are we feeling back pain or neck pain, or are you feeling some pelvic pressure today? And after gathering all that information, then they are presented with a truly personalized exercise program for them on that day. Um, so that's kind of the main functionality of the app, but also you literally have a PT in your pocket because you have the option to text directly with me.
Oh, cool.
Um, and while I can't give any medical advice, I can answer these questions. I'll give you a couple of examples of what I've gotten, like when should bleeding stop postpartum?
Mhm.
Or I've had this hemorrhoid now for 5 days. Like, what do I do about it? All of those things that I think my goal was instead of you sitting there Googling on your phone and
Yes,
just like
sure. Right.
doom scrolling,
Right.
like, why don't you just ask me and I can get you like an actual
Mhm.
answer? Or if I can't, I can at least point you to
Yes.
the right place
A
to
good,
go,
yeah,
you know?
makes total sense. Great.
Yeah.
Very cool. So I know, like, as we were saying, times postpartum can feel crazy and pelvic health can feel overwhelming, especially a lot of people, I feel like they're learning about it for the first time, often because they have some kind of symptoms or issue going on. Will you talk a little bit about how you're designing the app to meet people where they are and reduce some of that mental load?
Yeah. And this is something that was really important to me too, because I know that it's not the most fun thing that you have to deal with, right? Like no one really wants to
Right.
do their pelvic floor PT. It's like not it is very overwhelming. And so that was part of why I chose the name Amie. It's kind of a play on the French word for friend, because that's how I wanted the app to feel like warm, friendly, approachable, but still like professional. And you can still like trust that there's like real medical information in there.
Mhm.
Um, I also wanted to make sure that people could access their program like whenever they had time, right? Uh, Instead of having to say like, oh, well, like my PT appointment is at like 10 a.m. on Tuesday. 10 a.m. on Tuesday might not be a great time.
Right.
Um, if you log in and also, the full programs are typically around like 20 minutes. But if you say, you know what, today I don't have 20 minutes, I have 5 minutes right now. What can I do in that 5 minutes? It can kind of tailor it down to
Cool.
your needs. And that's what I wanted. I wanted it to really be able to fit in wherever there was space. And also working on getting kind of a better notification symptom system to remind women like, hey, like, do you have 5 minutes right now? Could we do like one or two stretches?
Right. Yeah.
So trying to make sure that it's not all living like in your brain
Yes.
because
Yeah,
there's a
no,
lot
that
going on in
too.
there.
Right, right. Well, and I love how you're talking about you can tailor it because one of the biggest things I had to learn after having kids was kind of that progress over perfection and the something is better than nothing and how that can really add up over time. Like 5 minutes, 4 times a day is your 20 minutes, and sometimes that is all you have. But I think for a lot of people before kids, like you're just used to being like, all right, I'm going to do a 20-minute thing and I'm going to finish that 20-minute thing. And so
Yep.
having an app that can support that kind of new way of going about your day, I think is awesome. And the more people can hear and know that it's okay to kind of trickle things in like that, and that it really does add up. Yeah, it's a powerful thing. So that's great to hear.
Yeah.
So I know you're currently in the beta phase and working with folks and then gearing up for a launch in September. Can you talk to us about what this phase has taught you so far? Have there been any surprises and how folks are interacting with the app?
Yes. Well, I learned like literally so much because I'm a physical therapist. I've never like built or launched
Yep.
or maintained an app before. So there was like that whole thing. But I think the the biggest learning that I had was, as I built this app in my head, I'm like, oh, this makes total sense. You go from this and then you do this next and you do this next. But when users got in there, like the first day, people were like, what am I supposed to do? Like, where am I supposed to go next? And I realized, like, oh, yeah, why would that make sense to someone who's like
Right.
never seen it
Sure.
before? Of
Yep.
course, it makes sense to me because I
Yep.
built it. And so
Right.
having to kind of go back and make sure that I add in very clear, specific instructions to like every part of the process. That was a huge learning and something that I think a lot of people in the like software world know, but like I
Mhm.
am used to explaining things to people like one-on-one in person. And
Sure.
so again, like translating that experience to app form was definitely a challenge.
Yeah, no kidding. I bet, especially just because, like you said, you kind of take for granted like what you know, and you're like, I've been designing it, so you get so close to it. So having that outside perspective that's new is always interesting and helpful. So that's
Yeah.
good to hear. Cool.
Yeah.
So we know, of course, that pelvic floor concerns are super common, but also very under discussed. I mean, I feel like we're starting to see this increase over the last, 5 or so years where more and more people are talking about it. Will you talk to us a little bit about how the app helps normalize this conversation?
Yeah. And I think I tried to do this in a few ways. Um, I think the first is just having it be in that kind of friendly context
Yeah,
where it's not like a super medical looking app, because, that in itself can be scary.
for sure. Yeah.
Um, and like as someone who has like white coat syndrome themselves, it's like, I get it. So presenting it in a, like fun looking context is one way. Also presenting everyone with the like pelvic floor benchmark assessment. And also having the pelvic floor symptoms in the symptom tracker along with all the other symptoms and having pelvic floor exercises like mixed in with all your other exercises, just like having it be in there and all the different ways just to remind people that your pelvic floor muscles are just like other muscles. It's just as a society, we've happened to put a lot of shame around it and
Yeah.
to, hide it and not talk about it. But I do think we are in kind of like I don't want to call it a golden age, but it's definitely a lot better. I feel like more
Yes.
people
Yeah.
are talking about it.
Agreed.
And so I'm hoping that it might not seem as shocking, when you're going through your program and you're like, okay, yeah, I did my squats, I did my, hamstring stretch, and like, oh, next are my Kegels, and we were just
Hmm.
like going through this
Yep.
as just another exercise.
Yeah, yeah. No, I think that's great. And it makes me think about how a lot of folks, they may feel unsure about whether what they're experiencing is normal. Of course, a lot of these things are common. Can you talk about how your app helps guide people without, kind of like we were saying, like without over medicalizing it or creating fear about what they might be experiencing?
Yeah, and I love you said it in there. I feel like every pelvic floor PT's catchphrase is like, this is common but not normal.
Yep, right.
Right. And I always hesitate on how to answer that question, like, is this normal? Because the
Right.
word normal has this like connotation of like, then it's fine,
Hmm.
right? And it's like, I guess the easy example for me is like incontinence, right? If you are pregnant or have had a vaginal delivery, it is very common to experience incontinence because of those things. Now, it is not normal because uh, it's something that we can do something about, and it's like
Right.
bothersome to people, you know? And
Yeah.
so I think um, I won't like keep going down the semantics road, but
Yeah.
um, I think part of the experience of the app that I really wanted to make sure was clear was, okay, you're telling me these symptoms that you're feeling. So, like, yes, I'm leaking. Yes, I'm having pelvic pressure. And then immediately after that, your exercise program will give you things to do to address those things. And so, even though it's like, yeah, it's a bummer. No one likes to admit that they
Right.
leak urine. But again, at least you're not just like on Google scrolling,
Right.
looking at all of these like confusing things. It's like, okay, you're experiencing some leakage. Here's the thing that you can do about it right now. Um, and so I hope that my intention with that was to give people some agency and to make it like not a scary thing, right? Or to I mean, if you Google incontinence, right, the first thing is going to be like surgery, medication,
Right.
all of these
Right.
things. And
Yeah.
it's like, okay, those are options, but why don't we try these things first that you can
Right.
do in your house right now for
Yeah.
like a couple minutes?
Right.
Um, and that's kind of what I wanted is to give people like really actionable things that they can do to hopefully kind of get rid of that fear
Yeah.
and um, just make it a little bit more accessible.
Yeah. No, I think that's great. Let's talk movement for a minute. What are your go-to tips for staying active if you are dealing with pelvic floor challenges?
Yeah, and I want to say first off that I know that it is disheartening to try and exercise when you have pelvic floor symptoms, right?
Yeah.
I feel like it makes people not want to exercise at all,
Yeah. Right.
which I totally get because again, it's a bummer when you're trying to do something and then oh man, I feel that pressure, you know? Um, but what I always try to work with my patients on is, first of all, let's tell me a type of exercise that one, you love, and two, you are going to do consistently. Right?
Yeah.
I feel like people are always like, well, my doctor said I could do yoga. Okay, well, do you like yoga?
Right. Right.
Are you going to do it?
Are you
Okay, if
excited about
not, then
this or
like,
dreading it?
right. Like if we're dreading it, then that's like not helpful.
Right.
Um, So find that exercise that you're going to do, and then let's find ways to modify it for right now, not forever,
Yeah.
um, where we can still do that exercise, but with either no symptoms or minimal symptoms.
Yeah.
And so I feel like the biggest example of this is my runners, right? Like I am never going to tell a runner to not run.
Right.
That's
Yeah.
just silly. They're not going to do it. But instead of your daily, 3 to 5 mile run, how can we adjust that? Do we
Yeah.
need to do like a run walk situation? Do we need to, instead of running up in the trails, do we need to do it on a flat road or on a treadmill? Do we need to look at your form, step length? Like, do we need to do a specific warm up? There's like hundreds of ways to
Right.
modify all of these different exercises and to find out what we need to do so that you're still exercising, you're still moving, um, but you're comfortable.
Yeah.
Um, because I think it's a huge, I mean, I like longevity is a huge issue now, right? And people are talking about perimenopause and how all need to start strength training, all of that stuff.
Hmm.
Um, and if we just like stop exercising altogether,
Right.
it's really going to hurt I mean, overall health, right? Cardiovascular
Yeah.
health, muscle strength, all of these things. So, and we kind of touched on this earlier. It's really hard to, not go on that 3 mile run and to be like,
Yeah.
really like a 10-minute run walk. It's
Right.
like, I am guilty of this too, right? Like
Sure.
if I can't do a 45-minute workout, what's the point? But at a certain point, you have to realize that like the way your life is different now. And so like
Yeah.
let's adjust to that and kind of make it the best that we can and acknowledge that it's temporary,
Yeah.
right?
Yeah.
As you get stronger, and as your body heals, you will be able to go back to those 5 mile
Yeah.
runs.
Right.
It just is going to take some time.
Yeah, I think that's a huge takeaway from this is that while it might feel like not what you want in the moment, it's not that it's that way forever. And that it's like you can progressively work up to those other things, but trying to go back to where you were immediately can make it harder and longer and all those kinds of things. So it is
Yes,
hard. It's definitely
exactly.
a roller coaster, like emotionally, physically, all of those kinds of things.
Oh yeah,
So,
absolutely, absolutely.
yeah. I wanted to talk just for a minute specifically about pelvic organ prolapse because I know we have a lot of people who are dealing with that. Can you talk about what some simple strategies or supportive tools are that can make a big difference in daily life? Because as we know, when folks are experiencing the symptoms, and like we're saying, like movement can be the last thing that you want to do. Simple things that were easy are now hard. Will you just talk us through that a little bit?
Yeah, absolutely. Um, I think prolapse is such a hard thing to manage and to deal with. And so I will try not to talk for like 20 minutes about all the tips that I have,
Right, this is a
but
loaded question, right? Yeah, I'm like, answer it quickly.
but I will say I have kind of like two things that I talk to like every single patient that I have who has prolapse. And the biggest one is bowel mechanics, right? I think I have no data on this, but I feel like a high percentage of women, we're always straining to have a bowel movement. And what happens when we do that, if we're holding our breath and like having that valsalva, is we are putting a lot of pressure downwards on the pelvic floor and on that prolapse, and that can exacerbate symptoms. And having a bowel movement is something that is happening, multiple times a day for some
Yeah.
people, multiple times a week. So it's something that happens a lot. So we want to make sure that we're doing it in a way that decreases the amount of actual pressure that's going down.
Mhm.
And so making sure that you are using either like a squatty potty or a stool, something that puts your knees higher than your hips. Um, Exhaling as you're bearing down, not like holding your breath. And then also making sure, because I feel like also constipation is a huge issue
It
with
is,
women.
yeah.
And so making sure that your stool consistency is good, in a way that works for you, whether that's like making sure you're drinking enough water, if we need to do like fiber supplement or stool softeners for those like early postpartum women, just making sure that all of that is kind of dealt with, is a big piece. And then the second thing is support, because I know it sounds weird to people, but a prolapse needs support like a sprained ankle needs support. Um, and there are many different kinds. There's internal and external. And so internal supports are called pessaries. They're inserted vaginally and they can help like hold the prolapse. Now, this can be a really scary thing for some patients. And like, I get that every time I
Yeah.
talk about it, people are like, oh my God, like, no, I do not want that. And like, fair enough. But they can be really helpful. And I also want to make a note that it's not something, again, that you have to wear like 24/7 for the rest of your
Right.
life.
Yeah.
But if you are not ready to commit to an internal support, I'm also a big fan of external supports and things like hem support wear, where it literally is just like an external support on that pelvic floor area, something to give you that like little lift. Um, and it's something that I think is such a simple way to get a lot of relief that people don't know about.
Yeah.
Um, and again, it's not something that you will need forever, most likely. And so just being able to say, like, okay, while I'm healing and while I'm getting stronger, I might need to use these things
Yeah.
in the same way that you don't need to wear an ankle brace forever after you have
Right.
an ankle sprain. You
Yep.
get strong enough, and then you might, not need to wear it ever again.
Yeah. Yeah. No, I think that those are really great examples. I know personally, I've used both internal and external support, and pessaries are amazing. I think they're a complete game changer. And if people are considering one, my thing is it's like always worth a try if you can do it, right? Because it's kind of
Yes,
like if you can swing it, try it. And then if you don't like it, pivot. But yeah,
exactly.
I like having multiple choices because I feel like for folks, yeah, it's like you were saying, it's not forever. And depending on the things that you're doing, you might find that one is more comfortable than the other or vice versa. And yeah, I think just the more options that we can have, the better that we can work all those things back in that, we're missing and want to be able to do. So I think hearing about all these different options is great because it can just, yeah, I think it just having that information is really helpful.
Yeah, and I'll put another plug in for pessaries. When we were talking about, I'll give my runner as an example. If without a pessary, she can only run, maybe half a mile before feeling symptoms.
Yep,
If she puts a pessary in and then goes for a run, maybe she can make it, a mile or two.
yep,
And so it's like using those tools for
yeah,
specific things. Like you
yeah,
said, like having the different options.
yeah.
Maybe she only wears the pessary when she's working out, and then maybe she doesn't need anything else, or maybe then she wears an external support on her
Mhm.
normal day to day. So
Yep,
um, I think again, I know it's like mentally hard to kind of like come around to some of these things,
yeah,
but I'm always like, could you just try it? Just like
right.
try one, right? And just
Yep,
see, like,
yep,
does it help you enough
yep,
to be worth it? And if yes,
yep.
like, great. And if
Yeah.
no, fine. At least you tried
Right.
it.
Yeah. At least right. Yeah. And then, I mean, for
Yeah,
me, it's been where I work it in and it's second nature. It's like, oh, I'm going to my workout, grab my pessary. I'm going to do this thing, grab my garment. And you just kind of work it
yeah.
in as like you grab your special workout shoes. It just kind of becomes part of like, what's that set of things that I need to do that activity. But there is like with anything that learning curve and just that kind of that inertia you have to get to overcome that like initial thing. And then once you do, you're like, okay, this is just, it's second nature at that point. But I
That's
think
my
like with
new
all things
routine. Yeah.
new, yeah, exactly. It can be hard to get into it.
Yeah.
I'd love to hear about a common misconception with pelvic health tech or pelvic floor care in general, that you are excited to overcome and challenge with your app.
Yeah. I mean, I think the number one biggest thing that people are skeptical about is I feel like most people don't think that pelvic health can be done not in person, right? It's
Yeah,
like via an app or like virtually. And I understand why people would think that, right? Like I
yeah,
get it. But what I've seen both through my users of the app and also just my experience doing like telehealth
yeah,
virtually, um, with enough instruction and enough different cues, videos, pictures, all of that, people are able to figure it out. Um, and I am not saying that an app like mine can replace in-person PT for everyone.
sure.
I think that's
Yeah,
not realistic, but there just simply aren't enough pelvic floor PTs in the United States to
yeah,
cover all the people who need it. And some people live in an area where there's like not one within like several hours of them,
right.
you know?
Absolutely.
Um, and so I'm very excited to prove that people can still get the pelvic care that they need on their own time. Um, and from an app that is hopefully, not hopefully, it is less expensive than like
Yes,
a
right.
out of pocket pelvic floor PT appointment.
Yeah. Yeah, I think that's a great point too, because yeah, it's far, it's time consuming, it's expensive. A lot of them, it's you pay out of pocket, and so I can absolutely see a place for this where, yeah, it's not the exact same thing, but there are so many things to be gained without the same barriers that come with the other.
Yeah.
That's good. Yeah. How do you approach educating people using the app about pelvic floor exercises, especially for folks who might be new to the concept? I know things like bearing down, breathing, that can be challenging, or folks who may be hesitant to try.
Yes. And so a couple different ways, I guess. One, which I just talked about, which is making sure that the instructions, the videos, all of that is super clear. And I'm also always giving people different ways to like do self biofeedback. And what I mean by that
Yeah,
is like, can you feel it on yourself with like, can you put your hand kind of under your perineal area and like
yes,
feel it moving? That kind of stuff to just help people figure out what they're what they're feeling, what they're doing. Um, the other thing is for people who are maybe hesitant or like are not ready for pelvic floor exercises or to like learn about that as a concept yet, is that while I present, the pelvic floor assessment to everyone, and while those pelvic floor symptoms are presented to everyone in there, it's not mandatory that anyone does it, and they can always come back to it later. Um, the beauty of the pelvic floor is that while we do have very specific exercises to address, like Kegels, right? That's a very specific pelvic floor muscle contraction. You don't need, like, not everyone needs to do Kegels to improve their pelvic floor strength.
right.
So
Yeah.
there are, if someone is having a pelvic floor issue, but is not ready to kind of, assess their pelvic floor directly or do Kegels, that's fine because other exercises like certain deep core exercises, certain like hip strengthening exercises can also help address the pelvic floor and stretches too. So we can still kind of work around it and kind of whenever that person is ready, if they're ever ready to like fully address it, it's there and all the educational articles and instructional videos, they're all there for them whenever they're ready, but we're never like pushing that on
Yeah.
anyone.
No, that's great. Thanks so much for sharing that. So I also know in this space, choosing support products can really feel like a guessing game, just everything that's out there, all the different information. What do you think makes a product actually supportive, and how does your app help folks make informed choices?
Yeah. It's there's a lot of stuff out there and I think it is hard for people. Again, you Google something and there's,
Yeah.
hundreds upon hundreds of different options. And so what I look for, or if I was buying something, what I would look for is to see like who's making it and why are they making it? Because the products that I've seen that work the best are made from people who have experienced this themselves, right? And so they know what it feels like to have this. So they know what a supportive garment would need to feel like to
Mhm.
relieve that.
Yeah.
Um, and I'll also put in there like they also know what they would want to wear all the time,
Yeah.
right? It has to be like comfortable and realistic, but also work. Um, and so on that note, like in the Amie app, and this, I did the same when I was just working as a clinician, is I made sure to only uh, refer patients to use certain products that I had
Yeah.
tested myself. Because things cost money, and I would hate for to tell someone to try something and it like doesn't do anything, right? And
Mhm.
then that's just
Yeah.
a waste of money for them. So in the app, I have a resources page for
Great.
like resources and referrals for products and also for like additional services. And again, I don't just put things on there willy-nilly.
Sure.
So it's not a super exhaustive list. It's pretty short, but my hope is that um, if someone is looking for a support garment, that they can go to that section and be like, oh, okay, here are the, two
Yeah.
couple choices. Instead of looking through hundreds of
Yeah.
options, let me look at these two and see which one do I think is going to work best for me. Um, and so I think we're getting into, uh, I'm like, the golden age of women's health, I feel like is happening because for like the longest time, the beginning of my career, the only kind of supports, even like pelvic supports, like everything
Yeah.
was just like super, it looked like a medical device, right?
Yeah. Right.
It's super ugly. Anytime I would like bring it to a patient, they'd be like, "Really? You want me to wear this?" And I'm like,
Right.
"Yeah, I know, I get it. I wouldn't wear it either."
Right.
Like,
Yeah. It's so hard.
um, and so it is nice that we have more options. And I think, there is that, and there are more options that people will actually wear. But also just I have tried some that don't do anything. So
Yeah. Right.
um that's the other thing is I want to try to, make sure that I'm staying up with like all the different ones that come out so I can try them and then, be able to refer to them or not.
Yeah. Great. No, that's super helpful. Thank you. Okay. Looking ahead, where do you see your app going post-launch? Any hopes or dream features that you can share with us?
Yeah, I have big hopes and dreams for Amie. I feel like
As you should.
this is kind of just the starting point. Right now the population of women that Amie helps is like pregnant and kind of early postpartum.
Okay.
Um, I want to be able to expand that population first for like longer postpartum because
Yeah.
postpartum really like never ends,
Yep.
right? Um, the second thing I'm really excited about is I really want to try to start to pivot people's thought about PT in general. Right now, PT, what you think about PT is you have an injury, you go to PT.
Yep.
Um, and what I would like to try and turn that into is more on the preventative side,
Yes.
like
Yeah.
how you see a dentist twice a year,
Yep.
right? You go in, they check, and they're like, okay, yeah, your teeth look great, but maybe you could floss more in the back.
Hmm.
Same with like a kind of a PT, preventative PT appointment, right? I want to expand upon those benchmark assessments,
Yeah.
have people do kind of a full body assessment, once or twice a year and say like, okay, everything is great, but maybe like maybe your core has gotten a little weaker. Maybe that like left hip is like a little
Hmm.
tight. Could we start to address that now before it becomes symptomatic,
Yeah.
and avoid having to do all of that
Yeah.
part? Um, so that's kind of, I don't have a timeline for when that's
Sure.
happening, but
Yeah.
that's something that I feel very strongly about wanting to try and get out there.
Yeah, that's amazing. I love it because ever since I was introduced to the world of pelvic health, I first saw a pelvic floor PT reactively, but since then I have shifted into proactive. I have an annual visit. I love just exactly like you're saying with your dentist. It's so important to keep like that baseline of how are things, going over time, and your body's constantly changing, whether it's aging, whether what you're doing is different, whether I mean so many things. So I think the more you can feel confident in that and be tuned into it, just the better all around. So that's very exciting. Great. Well, we're getting close to the end here. Is there anything else you want to leave us with before we wrap up?
I mean, I think all that I would say is that I really feel like we're getting to a point where public health is like more openly talked about and more accessible. And I just want, for anyone who's hesitant to, talk about with their doctor or their friends or anything, I want to encourage maybe looking into something like my app, something where you maybe don't have to like speak it out loud,
Yeah,
but it's
right.
still there as like a little baby step into that because I truly feel like when we don't address these pelvic health issues earlier on, they don't go away. Spoiler alert,
No,
right?
no.
And we don't want to be, like I feel like this generation of older women who had babies and then leaked for 30 years, right? And then ended up needing a surgery when they're 60. So I really want to try to encourage women, even though I know it's, especially in that postpartum phase, it's so hard to like think
Yes,
about doing something for yourself, but really trying to prioritize you and your body and, your mental health. Even if it's just again, like for 5 minutes
absolutely.
a
Right.
couple
It
times a
matters.
week, right?
Exactly. It makes a difference.
Exactly. Yep.
Great. Well, thank you so much for talking with us today and telling us about everything you're working on. I'm really excited for the release and then for Amy's future.
Thank you so much for having me. It was so nice talking with you.